Hi, everyone. Thank you for joining us for today's webinar, Chinese Scalp Acupuncture for Difficult Neurological Disorders and Long COVID Symptoms. My name is Robin Pierce, and I'm the Senior Brand Manager at Lasso OMS. Before we dive into tonight's content, let's quickly get acquainted with the webinar room. You'll find two tabs at the bottom right of your screen, Questions and Chat. Use the Chat tab to connect with fellow attendees and notify us of any issues. For questions directed to Dr. Hao, please use the Questions tab. These questions will be addressed during the Q&A session at the end. Remember that this webinar is recorded, and after it concludes, you'll receive a link to watch the video on demand and access the presentation slides. Meet Dr. Jason Hao, an expert in neuroacupuncture with a wealth of experience and accolades in the field, including successful treatments at Walter Reed Medical Center for veterans. He specializes in neurological disorders and has garnered significant media coverage for his achievements over the past 30 years. So without further ado, I'll pass it over to Dr. Hao.
Hello, everyone. I'm Jason Hao, the president of Neuroacupuncture Institute in Santa Fe, New Mexico, United States of America. Welcome to our 1-hour seminars. I will do some brief introduction for the neuroacupuncture for neurological disorders and the long COVID symptoms. Before we started, let's review some warming up movies. Let's start it. Steven, thank you.
I was with the Air Force. I started off as a policeman and then got into a tactical forces group, went to Iraq, had a lot of near misses, had a lot of close calls, but one of them got too close and we got hit by a couple of bombs, a couple of explosions, and it tore up my back and my neck and my head quite a bit and ended up having a lot of surgeries. I ended up having a lot of complications with it. And I came to a point to where I sort of hit a plateau and just wasn't getting any better. Still struggling with PTSD, pain, a lot of anxiety. I wasn't sleeping, I wasn't eating. I wasn't very well at all and was in a very bad place. There was a point in time in my life where I was definitely suicidal. If I'm being honest, I had a couple of attempts and ended up in an inpatient mental health facility because of it. I mean, that's how bad it was. I just didn't want to spend the rest of my life that way. That was just not my quality of life. That's not what I wanted out of life. And just was trying to find any solution and had a friend who came to Dr. Hao with a lot of success. Just the first treatment, there were instant results, and it was just incredible. It was absolutely incredible.
Specifically, if you can remember back, what were some of the instant things that you noticed?
The first thing I noticed was that I had blown out my right ear in the event, and it tends to be foggy in the right ear, but the very first thing I noticed was everyone was crystal clear all of a sudden. It was just incredible. I couldn't even explain it, but I could just hear everyone very clearly. And then soon after that, as he's doing his neuroacupuncture, I got this sensation slowly from head to toe of just this relaxation, almost a tingling from the top of my head all the way down both arms, down my back, my torso, my chest, all the way down to my toes. It was a wild experience. And I could tell just how tense the injury area was, and my whole body just sort of melted into the seat, into the chair. I remember asking Dr. Hao, how long will this last? And he kind of shook his head and looked at me and said, this is permanent. And I just couldn't believe him. It's been almost a year, and I have maintained that improvement. There have been several days of 0 out of 10 with mental and physical, head to toe, no pain, no anxiety, no anything. Just living life, finally being able to be present. And we had a child, we have a 2-month-old now, and if you were to do the math, We ended up getting pregnant just after we had got back from Dr. Howe's treatment. Just to be able to hold her and see her and look over at my wife and see my wife and see my stepson and just the family that I have around me, and being able to be there and be present is something that I cherish every day, because I don't want to miss those days. And I was missing them, but not now, not anymore.
Hello, everyone. Again, Jason Howe. How are you feeling about the film? In real life, we're going to face all of people like that have most difficult neurological disorders and post-COVID syndrome in past 3 years. So conventional medicine have limited offer for that. So if this kind of patient to see you, how do you feeling? Do you feeling confident you can make it better? Do you have any experience to know how to treat them? And do you know how to communicate with the patient? So this 1 hour will teach you all the skills you needed to help those people. Next, please. So they already introduced about this. It's very important. Make sure you have our Insta website done, and all the future class, contact information, how to get a free link for the movie, go to website, neuroacupunctureinstitute.org. Next. Ooh, that come on. So, this Father's Day, I got a special graduate card in your right side. The one patient I treated long time ago. And the graduate card he taught me, he graduated from high school with straight A and was into University of Texas, become college student. When he take this picture, he demand the family make sure my Dr. Howe get this card. You probably wonder why I bring him to open up. Now he's 17, 18 now. 12 years ago, he's a total disabled kid on the left side. Next. So when I started to see him, he's from Amarillo, Texas. I'm in New Mexico. 6-year-old boy with cerebral palsy. He never able to speak clear language, and also his coordination is poor, fall down all the time, and his arm is so weak when he's writing nothing in the paper, so he cannot communicate, and he cannot writing or drawing anything. He's a total disabled kid, and they kept him in kindergarten twice. Next, please. So you wonder how we're going to treat it. Special technique, neuroacupuncture. Neuroacupuncture include ear acupuncture, scalp acupuncture, body acupuncture. We call neuroacupuncture, we don't base it on traditional Chinese medicine theory. We base on Western medicine, neurology, neuroanatomy, and neuroscience. Anyway, my words skip around neuroacupuncture or scalp acupuncture for this introduction. So basically his condition, we use speech 1, speech 3, work on his speech, also work through the motor sense areas, balance areas, work his motor areas, working his weakness, arms, hands, balance, and coordination. The importance for this kind of treatment, I'm going to demonstrate later. You need to use your index finger and thumbs to stimulate the needle, rotate 200 times per minute. Next. What are the results in your mind? You probably think about that. After total 15 acupuncture treatment, he become happy, able to communicate, physical active boy. Everything is normal. Can you believe that? Mostly just scalp acupuncture. The one on the picture is the speech 1 areas. If you get those patients, you know how to treat it, you know how to evaluate that. You need to learn about the class from us. So I give a same presentation when I went to London, England last month. So during the open up lecture, they say, can we get more information about him? Yes, you do. After I was finished his treatment, I write an article and send case study, and the article was published same month I sent out. The next question, where is the article? I changed the computer many times. So in London, I searched myself. Guess what? I found this article on NIH website. So treatment of the children have cerebral palsy with Chinese scalp acupuncture, if you want to read it. Okay, next. So I'm from China, and I have 41 years experience on teaching, research, and practice scalp acupuncture. In 1989, I come to the United States to teach. In 2015, we established Neuroacupuncture Institute located in Santa Fe, New Mexico. And that's some of our class. And after I finished talking, and our director of the institute will introduce our next class. We'll be happening in next week. We still have a few spaces left. So if you want to join us, please hurry up. In the middle here, that 2017 I taught in Maryland, and we have 165 students. So we're successful. Yeah, welcome you join us in the future. Next, please. Since I come to the United States in 1989, there's so many newspapers, TVs, radios, and journal report my success stories treat those neurological disease. If you're interested, just type in Jason Howe neuroacupuncture. I think more than half is my stuff. You can see a lot of film there too. So, and when I come to the United States 30 years ago, even now, majority of the public medical school only know acupuncture for pain relief. Acupuncture as a good tool to help people suffer from neurological disease is a completely new concept. So I have to back to school, learn how to make the film, and 15 years ago. So all the film is posted in my website. And if you're interested and want to learn more, please visit the website. Also, you can guide patients go to the website as well. Next one, please. It's just some of the newspaper so many times. As an introduction, you see that there's many documentary movies about us as well. The most new one is a Return to Life. So one major person is a person and from veterans. Now, this movie is directed and produced by same film, 9,000 needles. And a lot of patients, we're going to cover that today, so you get some sense how you're going to treat them. And want to this film, please visit Neuroacupuncture Institute.org. And our director, AJ, put this link there. You register. There's a link there. Click that. Then you register. We send you a free link. And you can, it would be very good for you to know this film and your patient too. Next, please. So that's a major person in the film. And Jackery have head injury. When I start treating him, is injury, neck injury, 13 years. So severe neck pain, headache, nightmare, insomnia, anxiety, depression, and absolutely no energy fatigue. So he is totally disabled for 13 years. West medicine do many different ways, so they cannot release all about symptoms. And he have a lot of pain on the neck, headache especially, and anxiety. After 4 treatment, he completely recovered, back to full-time job. Now he make 2 babies. And please met him in the movies. And he traveled national, international to share his experience with acupuncture. So that motivation me and you as well. There's so many people there. They're paralyzed, they're loss of speech, they're loss of balance, and dizzy, vertigo, fatigue, anxiety, depression. So our treatment can help them get better, help them return to life, help them have new life. And so treatment for him is kind of easier. We use a head area, foot motor sensory areas, and upper 1/5 sensory areas. We're going to go through some of the areas in the future. Next one, please. That I did it last night. Finally, I found a picture about him. Here's another guy in the movie, and for this movie. And when I started treating him, he had a stroke. And he was a guitar player. And so right side paralyzed, arm, leg, and face paralyzed too. And also he cannot talk clear, and he balance off, fall down a lot of time. So he's a total disabled young man. He's 26 years old when I started treating him. So I treat him probably around 20 treatment. He completely recovered. What I use word completely recovered, he have nothing left wrong. So he play guitar again, and he run, he jump, and he decided I'm not going to do music anymore. He joined police academy. If any people know the police academy or your family in that field, it's pretty tough trainings. So even normal people, there's half of them that cannot finish, cannot done. So 2017, he graduated from there. He invited me join the graduation ceremony, and he total passed everything. He's a policeman now. I have another news, good news. Last year, he became father too, as well. So you change their life, give a normal life, not just him, his wife, and his parents, and everybody feeling big release. So we'll not only make them better, but there are many stroke patients we can make their life completely become normal. Okay? and meet him in the movie. Next. You probably have other questions in your mind. Well, we all know how to treat stroke a little bit. Maybe not good like you, but how about a more difficult patient like MS or Parkinson's? Yes, we can treat that too. This patient I treated, 6 years old, very familiar to local lawyer, and have multiple sclerosis for 20 years and 12 years disabled when I started treating him many years ago. He has severe fatigue, trouble walking due to balance off, fall down many times, double vision loss. Theoretically, he's almost blind, so he has a very, very close read, okay? And also have weakness of his leg. So treatment I give to him is use of balance areas, vision areas, upper 1/5 motor areas, foot motor sensory areas. I treat him once a week. After 3 treatments, all his symptoms are sight clear. No more symptoms. Even the eye back normal. According to his eye doctor, almost impossible. So after 4 treatments, he back to full-time job. And help us have established our Neuroacupuncture Institute. He is a board member, set our institute in a month. So for nonprofit organization, usually take a year or 2 for medical field. But since his impressive story he shared himself, 1 month we get approved, then we get class right away. So we have training a lot of people. You're going to like meet him. And now I train him about 15 years, 14, close 15. No symptoms. Only treat him once a month, every other month. He's from other city too. Have to drive 4 hours from us. So we treat a lot of MS patient and referred by him, and we have wonderful results. Hopefully you can learn, get good results as well. Next one, please. MS is very challenge, okay? And that is recover autism in the movie too. I did it for this class the first time. I shared that too. I had to snapshot from the movie. I cannot find his film, the picture. That is a 12-year-old boy, and cannot talk clear, cannot communicate, and only can say yes or no, simple questions, and not always answer questions. So he come to our workshop, our class, I mean, and so get 4 treatment. After total 4 treatment, he become complete normal kid. And you met the family that the dad introduced him before the treatment, after treatment. We just hug each other, we singing, we talking, we joking, and met his grandma. And by chance, a few months ago at the bank, he's normal kid. Very exciting. So we treat a lot of kids who have cerebral palsy and autism. So there's so many autism there. Hopefully you can learn that. We can have more people. According to my research, there's a 21.7 million kids worldwide suffer from autism. There's no treatment. So we have a lot of people. And in our clinic and my wife, we have 2 graduate students working with us now. So hopefully you can learn and you can have a lot of people in the future. Okay. And for autism kids and for cerebral palsy kids, don't put much needles. Usually we put about 4 to 6 needles. Like we charge people from after state, after country, I charge now is $350. So average about almost $50 one needles. That's your result. Tell you how much you worth. Hopefully you learn that. You can do the same thing like that. Next one, please. All right. What is neuroacupuncture? What is scalp acupuncture? So a lot of people were asking you, and you have gave some clear definitions. Scalp acupuncture is contemporary acupuncture technique, integrating two systems, traditional Chinese method needling stimulation method with Western method knowledge about neuroanatomy, neurology, and neuroscience. Scalp acupuncture have been shown how great result for treating central nerve disorders, such as stroke, you see, multiple sclerosis, Parkinson disease, traumatic brain injury, spinal cord injury, PTSD. Then we went to Waterloo Medical Center, treat a lot of people have phantom pain and CRPS. Anyone know CRPS? CRPS is C-complex regional pain syndrome. Basically, people have mild injury, they're developing whole body pain. So far, there's no treatment for conventional medicine. I have cured many of them. They also work for people who have cerebral palsy, autism kids. And we treat a lot of people who have Meniere's disease. So there's a lot of neurological disease we can treat. Ataxia, past 3 years, we have treated many people have post-COVID syndrome or vaccine adverse side effects. Post-COVID syndrome also called as long COVID symptoms. Neuroacupuncture often produces remarkable results with just a few needles. Sometimes only take several minutes, you can see people's life start change. I live in Santa Fe, New Mexico, with the institute location here. You know, Santa Fe, there's a joke, it's only two professions. You're either acupuncturist or you're artist. So there's a 70,000 population. We have 150 acupuncture here. And many of the artists, so I good Chinese artist. So all the art present here is my painting, my calligraphy. Next one. Please. Ooh, what's that? Okay, now better. Chinese acupuncture exhibition have been to use in China and Asia to prevent, treat disease for more than 3,000 years. Compare that, neuroacupuncture, scalp acupuncture, it only have 50 years of history. So in past 50 years, there's so many different types of scalp acupuncture developing. So what I talk is gel style scalp acupuncture today. And in our own class, you'll learn level 1, 3 days. You will mainly learn gel style scalp acupuncture. Level 2, where I'm going to teach you feng style, not popular at all in the West. In number 3, I'm going to teach you my style called house style scalp acupuncture. Gel style scalp acupuncture like this from one of the textbook They also call head acupuncture, only 17 areas. By combining these 17 areas, you can treat all of neurological disease and disorders. Next one, please. In gel-style scalp acupuncture, there's 17 areas. Most common areas will be motor area, sensory areas, in this tremor areas, and the other balance and foot motor sensory areas. For people learn other type of scalp acupuncture, or you learn from nowadays they call WHO standard acupuncture. It's very difficult to location to apply. For my technique, it's much easier. So I think it doesn't show on the slides. 2011, and my wife Linda Howe published our book. Should be a slide somewhere there, and called Chinese Scalp Acupuncture. Major, we introduced that in gel style scalp acupuncture. Don't contact us for the book. We don't sell that. You can go to Amazon, they sell there, okay? And they published in 2011. I think most of acupuncture school in the West now use this as a textbook. It's a very useful book, explain everything you needed. So the chart comes from this, from my book. Basically, the motor areas, you have to find right here, connect glabella, occipital protuberance, you find the middle point, and posterior the middle point, half centimeter, you find the upper point. Then you from an upper border of an elbow, make a horizontal line, connect occipital protuberance. Then this line cross with anterior hairline. So you connect these areas, it's called motor areas. 1.5 centimeter posterior to motor area and parallel to this motor area is called sensory area. Treat a lot of sensation problems. And in front this 1.5 and parallel to motor area is a tremor area. I work for a lot of essential tremor, involuntary movement, Parkinson disease, for example. Next one. So common use area, like I said, it use a foot motor sensory area, head areas, balance, motor areas. And all these areas is projection areas on the scalp corresponding to the interior brain functions. So in our training, in your practice in the future, you use this technique. You're going to use a lot neuroanatomy, neurology. So in our class level 1 class, for example, we're going to teach next weekend. I'm going to teach 2 days about gel style scalp acupuncture. Then we have Dr. Richard Scholar teach neuroanatomy. Then we have Dr. Louis McDade from a hospital neurology department teach you how to examine patient with all the hammers, tools, show you basic examinations in the neurology. There are 2 wonderful MD doctors have very good patient team up with us, and Richard Scholar doctor, he's so impressed, teach with me, see the patient. Now he take all MD doctors, so he has acupuncture too. So he merged that medicine, the knowledge together, and Dr. Louis McDade and his son graduated from our whole program, Sean. You might be met him, you join our program. He is our supervisor now. Okay, all right. Next. Foot motor sensory area is on top of the head. They can treat many illnesses. And I developed a whole bunch, couple pages for indication in my 34 years of practicing in America. So most cases in the book is all the really cases in my practice. Our practice is so busy. Normally we have 3 to 6 months waiting list. So that motivation me. We need to pass on this information. And most acupuncture struggle get fully practiced. After you learn this technique, you don't worry about that anymore. You're going to worry about you have too many patients. You don't know how to handle them. Okay, next. So, and I'm not only teach Chinese medicine doctor, I teach all MDs. Here the guy is Joe Hams. In order his group MD doctor learn that, he let me mark his head so we can use that and just see how relationship or area. He have the class located in California. So I teaching for his class for 15 years, training only MDs. I learned a lot from them too. Okay, all right, next. All right, we got an exciting part. Acupuncture, neuroacupuncture, scalp acupuncture, so effective, so simple. Why most of the users, or why most practitioners don't use very much? There's many reasons. Number one reason is that there's a limited resource about the book. Now we resolve that after we publish the book. Also, we don't have many good doctors and teachers, especially to teach, pass on that. Most of them, you probably already learned that in the school about theory. I'm pretty much sure all your teachers don't know how to use that to treat it. So you need to continue education, make you stronger, need to learn. So our class is desired for all of you. So number two is the location. It's a relative challenge, but we can teach that easy. Number three, most important, because a lot of your experience, it hurts if you don't do right. They hurt because you put the wrong layers, okay? So in our class, every 6 to 8 student, you're going to have a supervisor watch you, treat each other every day. And both and my wife, we do wonderful demos. Bring all the exciting patients to show you how we diagnose it, how we evaluate, how we approach, how integrating Chinese medicine, check pulse, tongue, herbs, and put needles to make people recover. So hopefully you can join us. Anyway, in order to reduce the pain, you need insertion the needles in right space on the scalp. So you pass 3 skin connected tissues. Upon neurosis, you go to loose areola tissues. So you go to loose areola tissues. When you pass the first 3, so your needles will be tight, then they will become looser. After you pass that, the right area much easier to put in. So we'll teach you many techniques that the level 1 class you're going to do like this. no tube. Listen, no tube. When you do tube, it hurts more and you cannot control. So that's level 1. Level 2, you're going to learn the technique, fun style. You're going to do this. And level 3, you're going to do this. And you're going to puncture each other, do this. That's the chart. Each one you're going to have this phone model. You're going to mark yourself. That's a student give to me. And then you are in the class. We're going to learn a lot this and the neuroanatomy, neurology, and neuroscience. So then you're going to, I cannot take them off. Anyway, you're going to learn all these different levels, why we stimulate there for the paralysis, why we stimulate here for vision, why with the loss of memory we stimulate. You're going to learn a lot about the brain. Okay, go to next slide, please. Ooh, we got there already. Time passed quick. Yeah, so the patient with introduction mostly just like that. Now we're going to go to treatment post-COVID syndrome. Since 2000, there's a pandemic affect the whole world economic, life, and our practice. So according to research lately, up to 50% people on the ICU survive. They have post-COVID syndrome. For people who have mild, medium, or no symptom patient, they have up to 20% them have post-COVID symptoms. Most of them is anxiety, depression, fatigue, insomnia, all kind of pain, strange, brain fog, balance off, dizziness, vertigo, and fatigue. There's no treatment at all. And in West Madison, because they still not figure out what's going on about that. Next one. Among all of them, most common symptoms during the COVID or post-COVID on your right side, you can see is the fatigue, shortness of breath, joint pain, chest pain, vision problems, and many neurological disorders. So according to my research, up to 70% of them have related to neurological, psychological problem. And we have wonderful results. Just use this gel style scalp acupuncture. Okay, next. All right, let's go to some patient that I treated one patient, 72 years old female, 2 years ago. And she had COVID. After COVID, she lost smell, taste, and anxiety, poor digestion. And from the left side of the tongue, you can see so many coating there, purple teeth mark. After treatment, one treatment, I didn't give her herbs. I didn't put out body acupuncture. I want to smell, taste, come back. But surprised me, look at her tongue on the right side, clear up completely. So then we will know his digestion wrong, anything else, probably related to anxiety. Is something in the brain caused that. And she hasn't recovered the smell, taste now. Okay, next. Simple treatment, chronic fatigue, food motor sensory on the top. And in front, there are 3 needles, work anxiety, insomnia, depression, foggy brain. On the right side of the picture is very useful for you for this time. And so you can see there's a one, let me see, okay, I can do it. Yeah, right here is the lower 2/5 sensory areas. From here to here inside is also we call smell, and taste one. So for people from a COVID vaccine or they have brain injury, allow smell, taste, you use this. And I put here the gift for this class. I have smell, taste, area 2. Okay, pay attention to, I'm not going to have a chance to repeat it. You do this, if it works, you don't need to do this. If it doesn't work, you want it, you need to add another needles, smell and taste. Area 2 is my point. You can call dark house smell taste 2. I discovered that. So from a pact of the ear, top of the ear, connect with the Taiyang point. You connect its 2 point, and from the middle, you go down 3 centimeters. That's good for smell taste. For people love smell taste, you do both sides. Okay, left side and right side. You might be combined with LF4, liver 3, and a large intestine 20, yin tongue point 2. Okay, next one. Oh, that's a very interesting guy. I was glad. So, 59 years old, male doctor, local doctor. He can make an appointment for me, and he lost smell and taste after COVID for 3 months. So he also have anxiety, foggy brain, shortness of breath, and fatigue. When I examine him, we say, "Sir, do you know your face paralyzed too?" You say, "Are you kidding me? I'm doctor. Wash my face." And watch my face and wash my face every day in the uniform. I don't have face paralyzed. You say, show your teeth, close your eye, blow, whistle, I take a picture. And we say, you not only have face paralyzed, sir, you also have the stroke. You say, no, I don't have stroke. I'm MD. Doesn't matter you're MD or scientist, you have the stroke. You say, how do you know? We say, show your tongue. His tongue, boom, divide it. Go back, move there, and go back, boom, divide it. We say, how do you think? He had a stroke. So for treatment, his smell, taste come back, and the face paralysis come back too. And he referred a lot of patients for me. And so when you learn that, don't afraid. You're going to learn that. You're going to compete with all the neurologists and family practitioner. So our class have almost half of them, and 1/3 at least is the Western medicine science. And we invite all the doctors from all over the world teach in level 2, level 3 class. You're going to meet them all. You're going to enjoy it. Okay, next one. That's it. Lower 2/5 model for face paralyzed, and the lower 2/5 model here for face paralyzed. Smell 2 right there, and that's for smell taste. Okay, simple, easy. Then there's a 1 point here. And in Jiaostar don't have that. So I add 1 more point right there. And from yin tongue go down, go to hairline. From hairline, you go to 2 centimeters down and 2 centimeters up. That's my point, called head areas. So for people who have foggy brain, insomnia, and per memory, you go from a hairline, go upper 2 centimeters. Okay? For people anxiety, you go to 2 down 2 centimeters. Okay, that's called head areas. In our book, we have that clear. I'm glad see the Stephen we did like seamless, wonderful. I talked, you shifted. So anyway, another important part for this scalp acupuncture, manipulation. You need a strong manipulation, use hand manipulation. So you have to twist the needles clockwise, counterclockwise, 200 turns per minute. Okay, then you want to get good result. For if you see, I get a little bit closer. You do this finger, don't do this way. You never fast enough. So you bend the finger like this, and your thumb like that. Do slow. You do this, 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 this. Fast, fast, fast. Then you get good results. So you have plenty of time. Can we correct you, let you practice each other? You come in the class. So just like that, just like that, just like that. See? Faster. Then you fly them up and then fly, fly, fly. And you're going to learn in level 3 class. Okay, next exercise. We have a few more minutes. Good job. Did it. So also we use a foot motor sensor for fatigue. I use head, anxiety here for foggy brain. Okay, next one. All right, that's a lady from Texas, and after COVID, he paralyzed the left arm and the leg. And the arm recovered, but she cannot move the left leg. So she also have anxiety, fatigue, depression, because there's no treatment for her. And that's the first treatment. When she left, we just say, bye. They'll grab her and take a picture. Very exciting. So that you can show scalp acupuncture often produces remarkable results very quickly. Sometimes, most of them, and in our practice, first treatment they see different. And after third treatment, she don't need treatment anymore. She's cured. Okay. All right. Next one. Who is this? I have no idea. Okay, I guess it's the same ladies, and just want to show red tape, little bit purple central crack. Shows right here something wrong in the heart and the lung, and worrying rolling pulse and stagnations. Okay, all right. I didn't see that slides last night. Come on. Okay, next, please. So for people you don't have much background about Chinese medicine, don't worry about that. Okay, so this treatment, we integrating them, but in the treatment the decision, you'll not check the pulse of the tongue. You still can get good result. Upper 1/5, lower 2/5, motor sensory, foot motor sensory, head, and tremor area. His arm and leg also tight. I put the tremor area. Next one, please. Wow, that's a very exciting one. 50 years of female from England come to see me last year before Christmas. Left arm and foot paralyzed, anxiety, headache, leg pain, depression, insomnia, fatigue, gain 100 pounds. So she is a total disabled. So I know her family had to treat her very quick. She has red tongue, teeth mark, thick white coating, very thready pulse. After one treatment, you're able to stand and walk. Okay? And after 5 treatments, all symptoms size is gone almost like normal. And but we didn't work on the weight gain 100 pounds. You probably have need come back to learn how to treat it. For people gain weight, overweight, quit smoking, ear acupuncture work better than scalp acupuncture. Next. The treatment, so simple. right upper 1/5 motor, middle 2/5 motor, upper 1/5 sensory, for the motor sensory area, reproduction areas. And so that I use for her. Next one. I think we'll have one more patient. Yeah. Where did it come from? 15 years old female, take a neck, OCD, anxiety, depression, different. I didn't prepare this way. I don't know even when they come out. So we treat a lot of children. Now we treat a little boy, little girl, 3 years old in Santa Fe. Mom in nursing hospital after he had COVID. She complete paralyzed from neck down, no movement at all, and also blind, cannot see. So after 6 treatments, she is normal. It's not this kid. She's a 3. I don't know where they come from. This okay, next one. I'm not going to discuss this one. I think we have one more gentleman. That's him. That's it. So he have a second vaccine. After that, have developing severe headache, insomnia, fatigue, anxiety, left elbow, also have pain from exercise. And you can see tiny red central crack. And next one, after 2 treatment, 1 treatment, the headache almost gone. After 2 treatment cured. I still contact him. The pain never come back. Next slide, please. Yeah. Simple treatment. Look at that. For the motor sensory, that work the elbow pain, and the brain here work of insomnia, anxiety, and the chest areas. So 2 treatment cured. Simple. Okay. So conclusion. Ooh, perfect timing. Look at me. I travel national, international, many places to teach. So my time pretty good. I've been in Europe, many class, and Dubai, Australia, China, Canada, just went to Toronto, Canada, England. We have a wonderful time. Anyway, in conclusion, scalp acupuncture has been proven to be very effective, safe treatment for mostly neurological disease and post-COVID syndrome. However, this technique still not known for the public. So we need together to promote this technique. Also, you need with Western medicine do research. Hopefully, in the future, we can uncover the mechanism, how it works, and so we can get more people get a benefit. I hope to see you in our class next week. You start with. It's a very short notice, but you'll be happy you join us. After you join us, graduate from all 3 levels, you're still with us. So after you take class, you become member of Neuroacupuncture Institute. We'll grow with you, developing with you rest of your life. And hopefully you enjoy that class. I have so many questions there. What we do about these questions?
I can thank you so much, Dr. Howe. This is amazing, amazing results. We are at time, so we do have time for a couple of questions. Any ones we don't get to, please email us at marketing@lasaoms.com and we'll get them fielded for you.
Can we share our class information? I'm sure they're going to ask about that.
Yes, of course. We'll share that for everybody. The webinar will be available. The slides will be available, and the video at the beginning also will be available. We'll be sure to share the classes. There were some questions about whether there would be any discounting. We'll follow up on that as well. Dr. Howe, what is your recommended treatment for left upper extremity tremors?
For upper extremity tremors basically use tremor areas, and they use tremor areas. Tremor areas is a projection area on the scalp surface. So the infront motor areas right here. In the old, you learn is all the way long. I changed that very short according to anatomy and neurology. So tremor area is projection area in premotor areas. That motor, that premotor. So motor areas, premotor areas. So they're very short, just right there. So you do both sides. For example, this patient right arm paralyzed. So you do tremor areas, both sides, left and right. Then the right arm, you do left side, middle 2/5 motor. Okay, so if I put a chart, you probably put needles this way. So one needles, two needles here, one tremor, you do one there, and you do another tremor area. Look, the tremor areas. Then you do opposite side, which side have the movement. We suppose their patient have a left arm, hand tremor, so right arm, I mean. Then you do left side, middle 2/5. From middle 2/5, from here to here. That's it. That's simple. And you do this stimulation for that. That answer that question. Next.
There's a couple of questions, Dr. Howe, around the use of e-stim machines and what your protocol is for that.
That's a good question. And hand stimulation have the best results. So yeah, we prefer use hand, but you're beginner or you're too busy, you can use the electric stimulation, but you use one pair or two pair maximum. Don't do too much. Brain too sensitive. When you use e-stimulation for the scalp, you use high frequency, lower intensity. Okay, pay attention to important word as speech. Repeat one more time. For scalp stimulation with e-stimulation, you use high stimulation, high frequency, lower intensity. High frequency, you use more than 60 to 200 hertz per minute. Basically, when you see the light, you almost cannot see the light. It's very quick. Then intensity, don't do too much. You're too strong, patient cannot tolerate. It causes scalp and muscle spasm. So patient barely can feel a little bit, it's enough. And usually I stimulate about 10 to 15 minutes is good enough. Next question, please.
Another roll-up of a couple of questions that ask about general chronic anxiety and depression, and you talked about some of that in your slides, combined with other symptoms, but specific to depression and anxiety and panic attacks. What is your scalp point?
Foot motor sensory area first. On top, right there. One here, one here. And next point, you're going to do head areas right here. The next 2 point I share with this class, you are teaching level 3 class. So you want to do the chest areas, head area, chest area right there. And from a head area, chest area, you form entirely triangle. So they need a very strong stimulation. Right there, okay? You look outside like this, inside should be triangle inside. And this, you might be compared combined with the shaman in the ear and the heart. Okay, next questions.
Excellent. We're going to try to chase down 3 more. Is there a great question from Laura Zronsky? How close do you schedule treatments for these conditions? 3 times a week, weekly? What is your preferred frequency?
Answer the question, I have my patient, a lot of people from after state, after country. So yeah, so for local patient, let's say depend disease. And if for stroke, for example, everybody have chance to see it. If at the beginning, you might be to treat them 2 or 3 times per week. Yeah. When their condition get better, you can treat it less frequently, once a week or something like that. But my business is extremely busy, too busy. I just don't have time to see them twice a week. So I see them once a week. However, for people from outer state, they stay in the hotel, they eat in restaurant, I treat them every day, 4 times a week, every day. So worth for their money spending here. And how frequently I'm quoting my experience, not important. The more important is total treatment. There are 5 treatment that have huge change, or more treatment have more change. So the total treatment is very, very important. Okay, next.
I think we have time for one last one. Dr. Howe, a couple of questions on what size, what brand, types of needles you use in the scalp, and do you use different sizes?
Good question. They always ask. I think we don't get the needles from Alexa. They're a company yet. So we will share that as soon as I get a class from them. So mostly I like to use the Chinese needles. Okay. For Chinese needles, you need needles to have this wired and have the loop. Okay. When you have the loop for beginner, you're easy for you to stimulate. Okay. For Chinese needles, and I use for adults is 1.5 inch, 1.5 inch needles. Okay, the length. The diameter, I use 32 to 34. In China, they use 28 to 30. It's much thicker, so I don't use that. I think that America, most of them, they don't care. They're chicken. The result is good. They hurt. They don't come back. So you use much thinner needles, but you still get good result. So 32, 30, so it's point 22 and 40 millimeter. That's for the adults. For children, I use 34 or 36. We'll use 1 inch needles, so much thinner. I want to add one more thing for this class. Something you have a good question. For children, you don't need a stimulation, okay? For children, as soon as you put the needle insert, no pain, you can leave needles. Retention needles for adult children is 30 minutes. Every 10 minutes, you stimulate. For children, you don't need stimulation. You put in, the results very quick. And some of the kids are treated 3 treatments for entire body spasm and paralysis. 3 treatments cure that. I have so many movies in our website. I have so many movies want to share with you in our individual trainings class start next week. It help?
Perfect.
Well, thank you. I see a lot of good comment in chatting, and thank you very much to join us with us, and keep tell Stephen and how good the class is. They invite us to keep back to teach. So I enjoy, and all of you, please, and thank Stephen and what the other lady, Robin. Robin. And thank them, put a lot of energy. We prepare, we have rehearsal. Now we want our director introduce Asia to talk about next class. Thank you. We'll see you next time. Thank you very much, Stephen and Robin.
Hi, everybody. My name is Asia. I'm the director of the Neuroacupuncture Institute. Our very next class is next week. We're very, very excited about that. And it's September 22nd through the 24th. You can sign up on the website, and that's neuroacupunctureinstitute.org. You can email me also, Asia, ASHIA, at Neuroacupuncture Institute with any questions about the class. We do also have a class coming up the beginning of next year. And so if you have any questions, just email me or email our lovely people here at LASA OMS, who have been gracious enough to host us again for another wonderful webinar. Thank you so much. And yes, we look forward to more. Thank you.
Thank you so much, Dr. Howe and his team. If you folks didn't catch it, we posted a 15% off code in the chat. If you scroll up to my name, you'll see a nice discount at LASA OMS for the attendees of this meeting. Okay. And again, Dr. Howe, thank you so much. Very inspiring. This is the largest attendance of any webinar we've had in recent history. So amazing success, and we'll look forward to seeing you again soon and potentially connecting with everybody at PCOM. And thank you. Have a great evening.
Yeah, have a wonderful time. Enjoy that. You can see I'm really engaged that, and time passed so quick. You're going to join our class here, and thank you for Lisa company and Steven and Robbie. You're wonderful. And thank you very much. And see you everyone in the future somewhere. Okay. All right. Bye-bye.
Thanks, everybody. Bye-bye.